Michelle, as we talk about rising cases, I think some of the basic, simple questions, without a vaccine, are we waiting for a national policy, perhaps, to require mask wearing as a very simple way to slow down some of the new cases that we continue to see?
Well, it certainly would make sense to have a national policy, or at least a really clear direction from the top of what we should be doing in terms of controlling the virus to the best of our ability. We have seen, though, that there's political reluctance to do that. And if you think about the way the virus is percolating throughout the United States, there are still some areas where there's very little virus and other areas where there are huge outbreaks. So there is an argument to be made that local people, local governments, local politicians should be able to make this decision. But to your point, is a mask a smart thing? No matter who you are, a mask is a smart thing.
So, Michelle, I mean, there's been a lot of talk prior to this by a lot of the medical experts we've brought on who basically said you're not going to contain coronavirus per se. I mean, it's always going to be out there. There's always going to be infections. It's more of a matter of how do you sort of get a vaccine, get therapeutics, and other sort of medical measures to sort of blunt the impact of it. How close are we to actually seeing those measures in place?
Well, yeah, I mean, that's a great question. The question you're asking is whether or not this is going to be endemic. If we're going to have another virus like influenza that we just all have to accept, that we're going to know every X period of time, we're going to see coronavirus circulating, and it's going to hit a certain portion of the population harder than other folks. I don't think that public health officials have thrown in the towel on this yet, honestly, and said that we're going to have to accept that. They are really hopeful that we're going to have a vaccine. If you listen to people talk about it, such as Tony Fauci, who's on the NIH task force and leads the NIAID, he's very careful in what he says. If we are successful with the vaccine, we might have it by the beginning of the year. And if it works, we will have enough doses. But there's a lot of caveats there. They are really hoping that we're going to have a vaccine within 18 months from the start of the virus. That puts us, honestly, about a year from now. And they're hoping that if we can get enough vaccination out there and we have some lasting protection, that we will be able to stop this virus like we are able to stop things like measles and whooping cough. But still, the jury is out on that, whether it'll be successful or not.
Michelle, it's suddenly coming to the fore of whether or not how politicized wearing a mask is, what steps can be taken from a federal level rather than just a local government level. But in your perspective, are we starting to see an improvement, at least in supporting those that do become unwell with the virus? We see, of course, hospital beds filling up tremendously fast at an unnerving capacity, certainly in Texas. Are more people dying at the moment, or is this more people are becoming infected, but through the learnings that we've already seen, particularly done in states such as New York, they're able to support those who become unwell that much more efficiently?
Well, that's a great question, and sadly, we're slowly getting the answer to this. And the reason why it's so important is because we did see a really sharp increase in the number of cases, and we saw actually a little bit of a drop in deaths. And it was very perplexing. No one could understand why that was happening. And there was this argument that perhaps we're treating patients better and we're having more success. There's also some evidence that younger people are getting infected more, and they're more likely to recover and not die. But then there's also this issue of a lag. And by that, we see we're doing so much more testing. Maybe we're testing and getting people earlier in the illness, and we're getting younger people. And as a result, what's happening is that the hospitalizations and deaths don't happen in the same time frame as what we were expecting. And so, in fact, we're seeing the deaths decline, but that's just a time lag. Now we're seeing in places like Texas and in Florida, the healthcare systems are starting to get overwhelmed. Hospitalizations and ICU use is going up. So it is looking a little bit more like those deaths are going to follow. And it's not just this discordance, the fact that we're having some success, because we do know a little bit better how to treat these patients once they get to the hospital and what medicines they need.